And of course, the Deputy Minister joins us live now. Deputy Minister, thank you so much for your time. Did your visit provide the desired outcome?
Good evening, Bongiwe, and good evening to the viewers. Yes, indeed, Bongiwe. Today we had a visit at a number of service delivery points. As an activity that is a prelude to the Presidential Imbizo that is actually taking place tomorrow, Mlambiti, Utuyela. So normally what happens is that we will then have our pre-Imbizos. Those are in the form of visits to service delivery points. They are in the form of engagement with stakeholders, and this is what we're doing actually. Today we visited the Ladysmith police station, we visited the Ladysmith hospital, and we just continue to hope to manage to make more engagements, probably also tomorrow.
And what are some of the issues that you found on the ground?
At the police station, I must actually say that in a long time, we have actually really managed to find a very, very well-run police station, the Ladysmith police station. From the building, once you come in through those gates, you immediately get a feeling that everything's fine. You go into the offices, you find that systems have been properly set. You go into the church office, so there's no queues. You look at the systems that they are actually using. Modernization is taking place. The charge sheet is done electronically, which means that, you know, in future or moving forward, there wouldn't be any problems about charge sheets that actually gets lost. We have a gender-based violence center that actually is a center that houses women and children and maybe men who actually come to report cases of abuse. That center actually manages to even create an overnight stay for them. They've got a social worker. In general, we went into the cells to look at the kind of cells they have for people who are apprehended while waiting for court appearances, and everything seemed to be okay.
And especially when you think, pardon me for coming in there, especially when you think about, you know, how in the past they used to have issues with toilets, for example, that were not, you know, properly functioning for officers, as well as those who would be going to the, you know, to their holding cells. And you talk about the issues around the digitization of some of the critical information that would be stored in that particular police station. Why is it so difficult to replicate this in some parts of the country where we are seeing this becoming an issue through some lost dockets and all of that in some of the police stations?
I think when it comes to digitization or having electronic records, most of the, I don't have the full statistics, but most of the police stations across the country now actually record electronically the charge sheets. It's a way of actually ensuring that information is properly stored and we don't have a problem of files that get lost when matters are supposed to actually be brought before the courts of law.
And I mean, one of the things that you also conducted was around the Sassa offices. And we've seen in KwaZulu-Natal in particular as a province that, you know, some of the beneficiaries would opt to sleep outside the offices in order to be first in line when they open, because the queues would be so long, the service would be so slow. What did you find there?
We didn't visit the Sassa office today, we visited the hospital. But when it comes to any sex delivery point that has got challenges with queues, we have, in a number of cases, been in the position to assist with innovative ideas that would be given. And every service delivery point with such a challenge will depend on a number of factors. It will depend on the number, whether we have enough staff, and how the records are kept, because, you know, sometimes, for example, if it's in a hospital and you find that there are long queues, sometimes it might be because of the fact that it becomes difficult for them to actually trace files. But when we talk about keeping electronic records. Even in hospitals, once the records are electronic, it reduces the queues because it's easy to access a file for a patient to then proceed to the next point. So basically, even with Sassa officers, I think if they are experiencing such a problem, it's a matter of really studying how the service is actually given, what could be the sore points, so that those sore points can then be improved in order for queues to actually be reduced. It is in our interest as the Department of Public Service and Administration, as we move around to service delivery points, to actually assist in whichever way where there are such problems.
And I suppose that the issue of the queues, I mean, one asked the question that, is it still really something we need to be studying? In 2023, we've had queues in so many offices. You can think about some of, the home affairs offices, for example. You think about the hospitals. Sometimes people wake up at 4 o'clock in the morning and they only leave a hospital at 4 p.m. because they would have gone through a queue to see to get to open a file, a queue to get to see a doctor, a queue to get medication. Is it something that we should still be studying in 2023, given the fact that it's been such a problem in some of these areas? Should we not have done away with it once and for all?
It is our intention to do away with it once and for all as government. And this is why we talk about modernization. It's something that we've been preaching about, modernization of public service, digitization of public service. And this is why, for now, what I'm actually reporting is that if you go into a police station and, for example, you find that information is electronically stored, it's part of the modernization process that the government is actually busy working on. Once we come to a stage where modernization is fully applied, we are hoping that all these challenges will then be eradicated. But for now, in some of the places, like for example, the same police station that we visited today, we didn't find any queues. We went to the hospital it was in the afternoon when we visited the hospital. There were no queues, and also my interest was, now if we don't see people, the other people that you're saying, they're saying most of the people come in the morning and they've already served them. So we do experience queues in certain places, and maybe queues that are not easy to handle. And in some cases, it might be because there's a new service that is just being provided, and therefore it has actually not been planned for in terms of implementation. Like, for example, if you talk about the 350s and the post offices, where you when the whole process started, I'm sure you've seen those very, very long queues. And it's also teething problems, because in some instances you would find that there are teething problems, but for the people who lead these processes, when they begin to realize what the challenges are all about and they begin to plan around the challenges, it then becomes possible for us to actually offer a service that is efficient and effective, that actually promotes the Batupili principles that we as the public service and administration department advocate for, because it is in our interest for South Africans to be provided with a service that says, yes, we do respect you, we take into consideration human dignity, and we want you to come into our service delivery points and actually get satisfaction in the manner in which the services will be provided to you. And that's what would be the principles that we actually advocate for at all times.
And as a final question, very, very briefly, was this visit only conducted, one would ask, because of the upcoming Presidential Imbizo tomorrow?
Come again, Bongiwe?
I'm saying that given the fact that tomorrow is the Presidential Imbizo, one might ask to say, were these visits to these particular entities conducted because of that?
Yes, we actually, normally, when there is a Presidential Imbizo, you'd find that all the roads lead to the area where there is the Presidential Imbizo. But that doesn't necessarily mean that when there are no Presidential Imbizos, ourselves, as ministers and deputy ministers, are not in the position in our own right to conduct these visits and stakeholder meetings. But whenever there is such events that the president is actually organizing, then we actually do the pre-Imbizos before the arrival of the president.
Okay, Deputy Minister, thank you so much for your time this evening. Do appreciate it. That was Dr. Chana Pilane-Majake, Public Service and Administration Deputy Minister.